Thank you very much. Honourable Speaker, I thank the Honourable Member for the question. The World Health Organization in November 2018 at the Executive Board meeting said that irrespective of wherever you are in the world, by 2030, NCD is going to be a problem, irrespective of wherever we are in the world. Initially, it was thought that this was a problem only of high-income countries, and low-income countries didn't have an issue with it, but it's growing. It's actually growing right around the world. It's so bad that there's only been 2 major diseases that have been captured at the UN level, at the UN General Assembly. One is HIV and AIDS, and the second is NCD, which was on the agenda in September 2011. What is now known globally is a fight right across the world headed by the WHO on what is thought to be the NCD countdown of 2030. And this is a global strategy of independent collaboration to form policies and strengthen health systems to reduce the worldwide burden of NCDs. If we look at NCDs and actually just demarcate one part of it, which is diabetes, in this country, diabetes prevalence was only 2% in 1970. By about 2002, this had risen to 15%. And by 2011, this was 16.3%. So when you see the graph has been climbing. We seem to think that we are plateauing. And that's what we hope, that we just curve the graph. And as I said earlier, this is a worldwide problem. There were about 58 million deaths in 2016 right around the world. 71% of these were NCDs. And 40% of these deaths from NCDs were from low-income countries and 90% in high-income countries. So what the data seems to suggest is that high-income countries have a greater burden of NCDs, and low-income countries have a lower burden of NCDs. But as I alluded to earlier, WHO is saying that by 2030, it's a problem, irrespective of wherever you live in the world. And NCDs we're talking about today is cancers, cardiovascular diseases, chronic respiratory diseases, and diabetes. And so as I've said earlier, Honourable Speaker, the NCD rise is global. It's not peculiar to Fiji. The STEP survey of 2002 and 2011 seemed to suggest that while we are plateauing a little bit with diabetes and also with tobacco use, we still continue to struggle with overweight, obesity, and high blood pressure. And it is encouraging to note that the 10-year difference seems to suggest a 1 to 2% rise. So while it's encouraging to see that it's a small rise, what is discouraging though is that over the last 30 to 40 years we've come that far. Looking back at the government commitment of the fight towards NCD, the government and the ministry is firstly very grateful to the increased budgetary provisions from before 2011 till today. Secondly, government has increased taxes on alcohol, tobacco, palm oil, and reduced taxes on fruits and vegetables. NCD drugs are now available throughout health centers and health facilities, but also the free medicine program, which was initially 40, then 60 medicines, and now 160. And lastly, whilst we are picking out those who have NCDs in the community, and we're actually being able to manage them with medicines, and as they continue to grow with the NCD, there's a possibility of getting complications. We have begun to be able to introduce specialty care, and I've discussed that earlier on this week in cardiology, nephrology, eye, and surgery, to name a few. So our main challenge at the moment is the intermediate risk factors of obesity, high blood pressure, nutrition, and physical activity. And this is a challenge that needs a whole of society approach. We all of us who are members of this August House, can be able to work with the community to be able to achieve this. We have new directions within Ministry of Health and Medical Services, and this has come about again because we're looking at what is best practice from around the world, and this is something that we've adopted over the last 3 or 4 years. We've moved from just a primary healthcare concept to what I've been discussing again earlier this week on universal health coverage, is being able to take the specialist services right down to the community so it's available at the point of contact. We also are using wellness approaches through the antenatal clinics, maternal child health, and the school health services. And we also have now what is called a wellness passbook that we are consulting so that we can give to all Fijians, and so that they can be able to look as they continue with their life on their wellness indicators of nutritional status, dental status, and also while they were younger, immunization status. And this creates a platform for early detection and referral of cases. Again, as I said, we're moving in the concept of universal health coverage. In order to curb NCDs, I'm sure that the Honourable Member will agree with me that everyone's effort is needed, and not only the government alone. And at the end of the day, the aim is to promote healthy lifestyle from conception all the way to the tomb. So it's a womb to tomb approach, as Dr. Tukana would say. Thank you, Honourable Speaker.